Okay, so this was a really tough case. This is a case of a patient who had PVR after a primary retinal detachment repair, small pupil, and you can see just a huge fibrotic membrane. I utilize a max grip forceps, which I love for this, to just grab and kind of did just grab, pray, and peel. Not very elegant, just tried to pull, and fortunately, we got somewhat lucky in a way and somewhat unlucky. This membrane was just so densely adherent to an area temporal to the macula that there was no good way to get it off other than to just kind of give it a really good firm pull. There was some hemorrhage associated with this fibrosis. I'm able to actually loosen it up, and then I treat it a lot like I do tractional retinal detachments. I'll go in and I'll actually segment this. So I'll segment it so that there's nothing kind of pulling anyplace else. And then our cutter is just so amazingly good at selectively removing this fibrosis. Now, unfortunately, there's a big retinal defect in the macula. And I believe that was from an impact site from a trauma that had caused this detachment originally. And we're able to actually go in and vitrectomize off that fibrotic membrane on this mobile detached retina. The key is I'm getting underneath the membrane, between the membrane and the retina, and keeping my port up. Here I get a little bit close to the retina, but once again, that really great 20,000 cut per minute cutter does so, removes that membrane without causing any traction or damage. I diathermize the edge of this hole, and it is in the macula. And then I'm going to use my cutter to actually drain over the break, and I like that because my cutter will face away from the hole itself, the break itself, and I'll use cutting actually, so that in case there's any vitreous or anything else close by. Once I get the retina a little flatter, then I'll switch over the soft tip, and we can see actually draining some of the subretinal hemorrhage. And this is fortunately liquefied subretinal hemorrhage. And the macula is at least relatively preserved. In fact, so much so that I can go in and do some laser. And in fact, what I'm going to use is the chandelier light to assist me so that I can actually drain subretinal fluid and some of that liquefied subretinal hemorrhage with the soft tip in one hand, dry it out, and before more fluid can accumulate, I'm able to apply laser to the edges of the break. Thanks again for watching.